Well, good morning, good afternoon, good evening, depending when you catch this, but welcome to the High River and District Healthcare Foundation social media. My name is Jody Seeley, and today we are doing a conversation on rounding up mental health. And we're so excited to not only bring you conversations around mental health, but provide you with information and give you access to resources within our community. And it's all for our Cattle and Grain Roundup campaign this year wanted to highlight mental health in a rural setting. And to kick off our very first conversation, we're so excited to have Helen Yoo with us. She is the AHS Community Mental Health and Addictions Clinical Supervisor. Helen, thank you for joining us today.
Thank you so much for having me today. We always love working with you guys, and it's so great to be here.
Well, and I think that it's just awesome to continually share with each other what kind of resources and what kind of things are happening within the community. And often, I think with the conversation of mental health, it's become a lot more conversational over the years. But sometimes we don't know what's available in our community or what's happening in our community until we're in the position where it's actually directly affecting us. And so I think the more conversation we can have around this conversation, the more we can sort of equip each other with options. Because I think, I don't know what you find in your field, Helen, but people, again, are more open to having conversations surrounding mental health, but there's still a little bit of hesitation. There's still a little bit of stigma attached to it. There's still a little bit of, am I like, should I really share this or does this show a weakness? Do you find that?
Yeah, absolutely. I mean, High River, Nanton, this whole area is so great about coming together as a community, supporting each other as, a tight-knit, smaller community, um, including things like providing support for mental health. And mental health is one of those things where there's always work to be done. There's always improvement for growth at each area in each community. So I definitely agree with you on that. I think in terms of what we're seeing at the front line, there is ongoing change, as there always is, but especially with how the last few years have gone for us, just overall, even globally, that the changes that we're seeing are even more rapid. And just the pace at which this field is changing is can be hard to keep up at times.
I can only imagine. And I think that there's so many factors that come into play. And when we talk about mental health, it's such a large umbrella at the end of the day. And so it's hard to sort of pinpoint some of those things, but we umbrella it per se in this conversation in just the fact that we want to let people know in the rural communities that there's access to support, that there's opportunities to get that additional help. And that help can be anything from, it might just be someone needing someone to talk to, all the way into something a little bit more deeper, because everybody's personal issues or challenges or elements that are happening in their life can be so very different.
Yeah, absolutely. Um, for us, what we see a lot happening in this community, High River, Nanton area, is changes with our most vulnerable groups of people. So that is with our child and adolescent population, as well as our geriatric 65 plus population. And we've seen that, as I said, with what's happened over the last few years, that those two populations were hit potentially the hardest with the aftermath of everything that's kind of gone on. We see that for our geriatric population, our 65 plus, that their mental health has gotten more complex. There's a lot more isolation. The number of geriatric referrals that we get at our clinics, at least, have increased. By folds compared to even just like 5 years ago. We have a lot of clients who are struggling with, living alone, living somewhat at times isolated in certain rural communities, and struggling to figure out how do they get their needs met without feeling too vulnerable while navigating systems and professionals that they've never had to do in their lives before. And so we do often see those people starting off in acute care settings or in emerge and then getting connected with us that way. For our child and adolescent referrals, um, we know that what's happened now is that there is economic and financial strain that's added a complexity to a lot of things that's going on with families. I'm sure a lot of families can relate to that, that things that weren't hard before are just that much harder at this point, including the mental health and well-being of the kids in those families as well. And so we see that they're having struggles in school, academically, having struggles with their peers in school, outside of school, those issues as well. And parents are just struggling to figure out how to get those needs met. We often work really closely with the schools, the counselors, family doctors, to try to provide whatever supports we can. In our clinic, it's outreach services, scheduled therapy for the geriatric population. We have a team of geriatric nurses that provide follow-up services for those clients. And how general population can connect with our clinic is typically through their family doctors or through Access Mental Health. Jody, did you want me to share that number with you
Sure.
right
Yes,
now?
please.
So if a client, anybody, thinks that they need some help, geriatric, child and adolescent, adult, um, anyone at all that's struggling with mental health, they can call the Access Mental Health line at 403-943-1500. And what will happen when they call is they'll get connected with a clinician who will provide an initial screener to determine what service would kind of make the most sense for the person that's calling in. Um, the Access Mental Health program is out of Calgary, and sometimes people have some reservations about having to call into the city to get services in their community, but they actually help us hugely by taking that front end assessment piece for us and getting a lot of really good information, providing additional resources that callers often aren't aware of, and they're just a great resource all around.
I love that. No, thank you for sharing. We
Yeah.
have it posted in the comments. It's up on the screen at the moment. If people want to take a moment and write it down, stick it in your phone, even because you never know when you might feel called to either call the number yourself or to give it to someone in the community who's looking for some support. Now, I feel like one of the biggest hurdles for people, Helen, is that they'd be like, well, I don't feel like I'm doing okay, but I'm probably better off than someone else. So I'm not going to call because I don't want to clog up the system or take attention away from someone else. And we'll often pass the buck in the space where we're maybe being nudged that we do need a little bit of help. What do we say to people who are sitting in that space?
Oh, Jody, we hear that from clients all the time, especially in this area. It breaks our hearts. And also, um, that we just want to take that pressure off of those people that are feeling that way, thinking that way, because it's our job to take that on, to make those calls, to do those assessments. Um, and we can work with those kinds of feelings, and Access Mental Health is really good about being the first point of contact to start figuring out, okay, you feel that way. Let's see, what the reality is, where you fit in most appropriately. And they're like the professionals that can help to kind of clear up some of those types of feelings.
Yeah. So I think if you're feeling the nudge, just call.
Just call,
Call.
exactly.
Just just call it. I mean, even if you're just like got reassurance that you're on the right path or you're doing the right thing, sometimes that can be worth its weight in gold because when we're feeling confused, when we're feeling afraid, when we're feeling anxious or unsure or just overwhelmed, often that reassurance is the first piece that we need to just be like, you got this. You
Absolutely.
got this. Yeah.
Exactly.
I love that. Okay, so some of the funding from the Cattle and Grain Roundup, of course, we have this mental health focus and lens that we're doing for this campaign. And some of that funding is going to support the adult day programs. Can you tell us a bit about what those are and how we can access day programs?
Absolutely. So, why don't I start by sharing? It's a completely fictional example, but one that um, is a story that we hear all too often. So this is completely fictional. I'm not breaking any confidentiality at all. I'm literally making this one up. But let's say that there is a 55-year-old individual who has been a part of our communities their whole life, and their whole life they've lived with their extended family, aunts and uncles, their whole life, has never had the opportunity, including, doesn't have the intellectual capacity, the skills, the emotional stability to live on their own. And their, let's say, aunt and uncle live pretty remote, slightly out of town. And what's happened is that over a span of 20 to 30 years, this individual has become more and more isolated. And as a result, their ongoing issues with cognitive impairment, or developmental issues, and their mental health has become more complex and more challenged as a result of their isolation, as a result of these issues that I mentioned just adding on and building each year. And so at the age of 55, this person has no means and no ability, resources, outlet at all to start getting the help that they want. And so what happens is this extremely complex um, case first makes their contact into our clinic at the age of 55 with all these issues that our clinic and at times our community is very limited in supporting, just because of the complex nature of what's going on for this individual. And so what happens is at the age of 55, they connect with us. We give them some therapy for a few months. They do okay, they stabilize with their mental health, then they fall off our radar again, only to re-engage a few years later. We try to do what we can with the resources that we have, get them to a stable level, they fall off our radar again. And it becomes this repeat cycle because they just are struggling with the complexity of what's going on for them. The, sometimes what we feel is a lack of resources for such complex cases. And they just become like this, same repeat referral again and again and again, while not actually getting the help that they actually need. People like that require a lot of means, a lot of resources to actually have their needs met. And what's happened is our partnership with the foundation and our clinic, we created an outpatient outreach program for exactly that population. So we're not doing talk therapy that helps only so much, but it is a weekly extended program where we'll meet with this, we call it like a chronic and persistent population, just because they kind of just get to that, okay level, drop off, come back again. Chronic and persistent has some, positive and negative connotations with it. But just for ease of, to describe this population, it is targeting that chronic and persistent population. They'll engage with us for 2 to 3 hours on a weekly basis with two of our wonderful outreach clinicians, where they will focus on life skills, social skills, things that they need outside of talk therapy to be able to develop a network outside of our clinic, develop a community, near where they live, outside of professionals being a part of that community. And they'll be able to build on some of those life skills and those softer skills that'll help their mental health in a holistic way. So we'll be hopefully starting our day program in the spring. Like I said, it'll be 2 to 3 hours on a weekly basis with two clinicians. They'll be focusing on things like cooking, how to, pick and choose healthy groceries while on a budget. They'll be focusing on how to access community resources, mental health, recreational, interpersonal, all of the above. Hopefully, they'll build a community amongst their peers in this kind of environment. Um, and it'll run for about 3 to 4 months, which is a really good chunk of time, especially for a day program like this. Does that kind of
Yeah, no,
answer
that's
your?
awesome. So
Yeah.
if someone sees this and they're like, "Oh, I would fall into that," or "That's exactly like my family member," or "I know of someone in my community who I think could benefit from this," do they reach out to you? How does someone get a part of the program?
Yes. So this year is kind of the pilot year where we're first trying this out and seeing how
Yeah.
it goes. Um, I'm going to be honest, in our population, that chronic and persistent population is, um, a group that we work very closely with, that we've always worked closely with. I guess what I'm trying to say is we already have a pretty
Yeah.
full roster to start up this pilot year. But if you're one of those individuals, or you think that you are, or somebody who might fit that criteria, give Access Mental Health, that phone number that I gave earlier, a call. We'd love to connect with you, see what we can do to support you at this point. It may mean the group, it may mean some other programs that we have in our clinic, and we'll kind of take it from there.
Yeah. No, I think it's great. And just good
Yeah.
to know that as a community, when we've come together, those who are supporting the Cattle and Grain Roundup campaign, money is going into helping people that we know are just, waiting for that resource to be able to
Yes.
take them into the next level in the community. And that feels pretty good at the end of the day, from when when you're donating to a program, to know exactly how that is supporting in your community and how quickly that will be rolled out. I think is really amazing at the end of the day, that all of these pieces are moving together.
Yeah, exactly. I think a lot of our clinicians, our outreach clinicians who work most closely with this population, were kind of able to let out like a sigh of relief, knowing that we have this program now, that we will be able to trial it this year, and that we actually have something that will sufficiently meet the needs of this population.
Yeah, I love that. Now, the
Mhm.
next piece that I know you're going to be attending to be a part of, I will be there as well. But we're gathering a group of really cool people, and we haven't. This is the first anybody gets to hear of it so far. Is there is a Head to Heart Rural Mental Wellness Fair that is coming to Nanton in March on Saturday the 23rd. So we're going to have you save that date, and it's going to be a great opportunity for people in Nanton, High River, the surrounding rural area, of course, to come in and just get access to more information. We've got a great keynote speaker in Chris Cook coming to motivate us and to have a few laughs. And we're going to be going through some great tools. But I think this is another initiative that, often you think, okay, do I want to come to town to go to a mental wellness fair? You would ask yourself. But it's a great way to come and connect in with community and get those resources if you're still feeling a little bit shy or hesitant in getting that support for yourself. Helen, I'm sure you've seen in things like this in the past. It's kind of a soft way to introduce supports and resources into the community.
Yes, that's exactly it. As soon as Alex, my manager, and I heard, I think we responded to you guys in like 30 seconds that we'll be there. This is one of the privileges of working in a community like this, that we can, we'll be there to answer any questions, have real face-to-face conversations with you about anything mental health, our clinic, what's going on, you know, for you in the community, anything at all. We'll have resources available, phone numbers, we'll have squishy stress balls with the Access Mental Health number on it. I can't
Perfect.
wait for it. I'm excited to hear you and other keynote speakers. Yeah, sounds like it'll be a great event.
When I think too, we really want to extend that invitation into our ranching and farming community, because we know this is another community. And I'm sure you've seen a lot of this in your work too, Helen, where there's a lot of pressure running a ranch and a farm, especially in today's climate. And it can be very challenging, and all of the pieces that go into that. And I think it's a very, I'm gonna say, like, it's a very rural, like, because I grew up on a farm, like, I know the languages. You just cowboy up and you try to power through. And often, uh, we need some support in that. But it's very difficult to admit when you're in that space, or to feel shy about it again, or the stigma, or is it a weakness, or how do I, connect with people without people thinking something ill of me in that process. And just again, reminding people it takes incredible strength, not weakness, to ask for support. And running a farm and ranch in 2024 is not a simple task. And all the supports you can access to help you, um, they're there for you for that reason.
Absolutely. And, with working with you guys, I've learned that you can connect with the mental health field to have your needs met, to learn, to get the help that you know you need. And you can also connect with the mental health field with giving and lending a hand, as this community so often does. Our funding came from, I think initially, or a part of our funding came from the 4-H group in
Yeah.
this area. And I had a chance to meet with them, and they were a wonderful group of young individuals. So if you have any connection at all to mental health, whether it be that you've supported some of our programs in the past, or that you are wanting support, I would love to meet you, express my gratitude, um, you know, guide you to where you could possibly go, all of the above. It would be great to see people's faces at
Yeah.
this event.
I think it's going to be great. Helen, anything else that you want to add for people today in, starting these conversations, accessing information, getting access to resources, or anything else with your department?
I think just that it all starts with a conversation. That's what the phone line is. When I'm there on the 23rd, that's what it'll be, just conversations. And that's just a really great place to start some of this kind of mental health work. I also say thank you so much, Jody, and to the foundation, and to everyone that's provided support for our clinics and the programs that we're doing.
Awesome. Okay, I'm going to put this number up one more time. Again, if you want to screenshot it, if you're watching on your phone, writing it down, putting it in, just having it available in your phone, in your fingertip, on that Post-it note in your office, whatever that looks like, just in case you or someone you know would like to start a conversation for what kind of support you could get in our communities in both Nanton and High River, is by calling this number. And just get started. Make the call if you're feeling the nudge, and don't worry about all the hows and the who's and the whens and all the things after. That's what this team behind the phone number is there to help you with. So feel free to share that. Throw it up on your social media. I always like people just make a post. Hey, if anyone's feeling like they need to have another conversation or get a little extra support, here's a number you can call just in case, right? Just the more we share, the more we know.
Yes, exactly.
All right. Well, Helen, thank you so much for your time today. We look forward to meeting you in person and having some fun in Nanton in March. And again, just thank you and your team for all the incredible work that you're doing in
Oh,
our community.
thank you also, Jody. This was great.
All right. Have a great day, everybody.